Hello, this is Angelia, and you're listening to or watching the podcast, Why You Do What You Do. The podcast that has to do with human development and psychology to help you figure that out a little bit more. Now, last time we were talking about psychopathology, and we touched on schizophrenia, and we're going to take back up from there. Schizophrenia is a mental disorder marked by loss of contact with reality. Symptoms include hallucinations and delusions. And it has a strong genetic component. The risk of schizophrenia is 10 times as great among siblings and offspring of schizophrenics as among the general population. So, unfortunately, if you had someone in your direct lineage that had schizophrenia, you're a lot more likely to have it. The twin and adoption study suggests that this increased risk comes from shared genes, not shared environments. So it's genetic, not your environment, unfortunately. The estimated genetic contributions is between 63 and 85%. So that's more than half of a chance that if someone in your direct lineage had it, that you're going to have it. So if you're experiencing anything, like hallucinations during the day, and everybody has dreams and things like that. I've had people criticize that I have dreams. But it's like, no, because I was asleep. I was not awake. I didn't see things while I was awake. I didn't hear things, and we can delude ourselves about a lot of things, but that's not, schizophrenia. Brain imaging may be useful in the search for genetic basis for schizophrenia and other psychiatric disorders. And that's because sometimes, if there are large spaces in the brain, then it's more likely that you're going to have this problem. So they can actually do some imaging and look for these things. Autism, pervasive developmental disorder of the brain, characterized by a lack of normal social interaction, impaired communication, and imagination, and a highly restricted range of abilities and interests. Now, I have a son who has Asperger's. He's on the spectrum. And now that we know as much as we know, I believe that my husband and his mother have Asperger's and are on the spectrum. And of course, they're not going to go get tested at their age, but, there's some signs. Now, my son was nonverbal until he was 3 years old. And that's when we took him to the doctor and said, hey, this kid's not talking. He doesn't really like to play. He likes to stand up against the wall and imagine things and make boom bang noises. And, he kind of is doing his own thing. And the pediatrician that we had at the time said, oh, well, here, and he brought me out this piece of paper with the signs, and he said he probably is on the spectrum. You might have to put him in a home when he gets older. That's such a shame. Well, he was wrong, because this child became one of the most social children I actually have. He went out, and he played sports, got to know a lot of people, still has friends. So, the pediatricians aren't always right about this. You have to let these things play out. So you can't make any major life decisions for your child when they're a young child, because children can get better, children can change, and children can outgrow things. Oh, it's so hot here, and, every time you open the door, bugs just come in. It usually appears within the first 3 years and continues to varying degrees throughout the life. Okay. 4 out of 5 autistic children are boys. And, they're not sure why that's a thing yet. But, it seems to be a thing. So, and then there's some, goodness sakes, people who, say it comes from the mother. But, like I said, we don't have that. I have like a very distant cousin, I think. So that's not really something that runs in my family. But however, I believe it runs in, my husband's family. So, I don't think it came from my side of the family, honestly. An autistic child tends to avoid eye contact. And he did this, and like when we would pick him up when he was really little, he would arch his back and look away. It was like it hurt him to like be picked up by us. And as a mother, that's just pretty devastating, because you want to love on your little baby and everything, and then when the kid is like, like you're doing something wrong to him by picking him up and touching him, that hurts your heart. And even with their parent, their children often can learn basic social skills through behavior therapy. And I think by us taking him out to parks and letting him be around other kids, and letting him participate in things, that helped him tremendously. That he overcame that isolation that he was putting himself into. Okay, and prenatal development, the stages of prenatal development, we all kind of know about that, so I'm not going to get into all of that. The Cephalocaudal principle, from Latin meaning head to toe, dictates that development proceeds from the head to the lower part of the trunk. So, we develop from the head down. Let's see, according to the Proximodistal principle, from Latin meaning near to far, development proceeds from parts near the center of the body to the outer ones. So like if you look at a picture of a baby, we all kind of look like, a chicken and egg. But we'll start with that head, and we'll have a little eye spot. And eventually you'll start being able to see the heart and the brain and things. And like I said, from the most important parts, you could say outward to the other parts of yourself. The germinal stage, the fertilization to 2 weeks. During the germinal stage, from fertilization to about 2 weeks of gestational age, the zygote divides, becomes more complex, and is implanted in the wall of the uterus. So that's when, your sperm and egg come together, forms the zygote, and the zygote attaches to the wall of the uterus and starts growing blood vessels and things that it's going to use. Oh gosh, these gnats. I guess one little gnat. It's just bugging me. And, you start becoming you. Okay, we looked at that. Early development of a human embryo. The simplified thing shows the progress of the ovum as it leaves the ovary and fertilizes in the fallopian tube, and then divides while traveling to the lining of the uterus. Now a blastocyst, it is implanted in the uterus, where it will grow larger and more complex until it is ready to be born. My goodness. Oh my goodness. This thing won't leave me alone. Okay, at a month old, during the first month, the growth is more rapid than any other time. During prenatal or postnatal life, the embryo reaches the size of 10,000 times greater than the zygote. So in the first month, it goes from being a zygote to 10,000 times bigger. And of course, it still just looks like a little oddball chicken and egg thing with a little heartbeat, At 7 weeks, by the end of the second month, the organism is less than 1 inch long, weighs only 1/2 ounce. So this is where you start, seeing the eye spot. You can see little hands, little feet, nubbies, and you start seeing that there's veins and things like that. It starts to kind of look like it could be a baby. At 3 months, by the end of the third month, the fetus weighs about 1 ounce and measures about 3 inches in length. So, think about 3 inches. You got a baby, it's about 3 inches big. And by this time, you can start to see that there's some ears. He's got his little toes and fingers and his little eye, and you can start seeing a nose and mouth. At 4 months, the body is catching up to the head, which is now only 1/4 the total body length, the same proportion it will be at birth. And at this point, he's fully formed. He doesn't have a fat layer yet, but he can suck his thumb and things like that. At 5 months, the fetus, now weighing about 12 ounces, is 1 to 1 pound and measuring about 1 foot, begins to show signs of an individual personality. And this is when, back in the olden days, used to call that the quickening, when you felt the baby move. They believed like the baby wasn't really having a spirit in it until it started moving. It was just a lump of flesh, and then the spirit would come down from heaven into the baby at around 4 or 5 months, and the quickening would happen, and it would become a being. At 6 months, the rate of fetal growth has slowed down a little. By the end of the 6th month, the fetus is about 14 inches long and weighs 1¼ pounds. So by this time is the time he's starting to get his, waxy covering on him, because, he's going to have to leave the womb one day. And this keeps him protected because he's in a sac of amniotic fluid as well. At 7 months, by the end of the 7th month, the fetus is about 16 inches long and weighing 3 to 5 pounds. Now has fully developed reflex patterns. So, if you were to test the reflexes, and unfortunately there have been premature babies born at this point where they could do that, they would have the normal reflexes. At 8 months, the 8-month-old fetus is 18 to 20 inches long and weighs between 5 and 7 pounds. Its living quarters are beginning to become cramped, and so its movements are curtailed. So, it doesn't move as much. It rolls a little more. One of my babies was so big, it was like 8 pounds and 1 ounce, and I'm 5'2". So, he was a large baby in my small body, and he was pretty crowded, and he would just kill me sometimes. He would get his butt, up in my ribs, and I would just be like, baby, go down a little bit, move a little bit. And, I could tell he wasn't happy with that, but, it was cramped in there. At 9 months, they become born. About a week before the birth, fetus stops growing, having reached an average weight of about 7½ pounds and a length of about 20 inches, with boys tending to be a little longer and heavier than girls. And all of mine were big kids. All of mine were over 7 pounds. I think the smallest one of them was 20½ inches long, and that was my youngest. And then the other one was like 21½, and then I had one that's 22 inches long. He was, I don't know, rolled up like a snake in there. I don't know. But, even in the early stages, individuals differ. The figures that we've given here represent averages, of course. The embryonic stage, the second stage of gestation, 2 to 8 weeks, characterized by rapid growth and development of major body systems and organs. Spontaneous abortion, natural expulsion from the uterus of a conception that cannot survive outside the womb, also called a miscarriage. So some people get very upset about a miscarriage, and of course we do, because that's our baby and we love it and we want it. But nature has programmed that into us. Now there's some women who can't carry a healthy fetus, but a lot of times in a healthy woman, nature realizes this baby is not going to be able to survive outside of the womb. It has major defects, and so it stops taking care of the baby, and the baby is expelled from our womb. And that's sad when that happens, but like I said, sometimes nature knows best. When birth defects occur, body parts and systems are most vulnerable to damage during critical periods when they are developing, most rapidly, generally within the first trimester of pregnancy. Intervals of time are not at all equal. So again, like I said, sometimes nature knows best, and usually if you're going to miscarry, it's within the first trimester. Fetal stage. The fetal stage of gestation from 8 weeks to birth, characterized by increased detail of body parts and greatly enlarged body size. So really, it's amazing how we become one little zygote cell that you can't even see, it's microscopic, to, this 20.5-inch long, 7-pound being that is now going to leave its mother's body. An ultrasound, prenatal medical procedure using high-frequency sound waves to detect the outline of a fetus and its movements, so as to determine whether a pregnancy is progressing normally. And any of us mothers know we love those little ultrasound pictures. You get to see your baby's face for the first time and his little feet and all that stuff. And it's just wonderful that we have that, my goodness, technology now where we can do that. Good gosh, Nat, get out of my house, get out of my life, in the name of Jesus. Teratogenic, capable of causing birth defects. Environmental influence, maternal factors. Not all environment hazards are equally risky for all fetuses. Some factors that are teratogenic, with birth defect producing, in some cases have little or no effect in others. The timing of exposure to a tetragen, my goodness. Its intensity and its interactions with other factors may be important. Sometimes vulnerability may depend on a gene either in the fetus or in the mother. For example, fetuses with a particular variant of a growth gene called transforming growth factor alpha have 6 times more risk than other fetuses of developing a cleft palate if the mother smokes while pregnant. So, it's not okay to smoke while you're pregnant. If you're smoking, stop smoking when you're pregnant. Excuse me, here, this gnat just keeps bugging me. I guess it's looking for moisture too because it's 99 degrees. But my eyes and nose are, not the optimal place for it to find that. Nutrition. Pregnant women typically need 300 to 500 additional calories a day, including extra protein. So, you do need to eat for 2. And you need to take vitamins. I could not take prenatal vitamins. I could not take the iron. Couldn't find out I'm allergic to iron. It breaks me out. I get a rash. I throw up. So we had to come up with another way, which was, taking children's chewables a couple times a day. So, you need to take some kind of vitamins that are going to be equal to your prenatals. Because that's going to help you have a healthy baby. And if you can't take them, tell your doctor. Unfortunately, I wasn't listened to, and I got really sick with my first one. And I ended up having to go to a specialist who diagnosed me with, I think it's called hyperemesis gravidium. I'm not sure what it's pronounced as. But anyway, I got sick for like almost 8 months straight, 6 times a day, every time I ate. So, that didn't work so good for my first kid. But, he's awesome anyway. Physical activity. Moderate exercise does not seem to endanger the fetus of healthy women. So you can still do moderate exercise. Of course, you're not going to want to do jumping jacks or high impact aerobics, something like that. But a little dancercise, a little stretching and, basic exercises, yes. Still good for you. Drug intake. Practically everything an expectant mother takes and makes its way to the uterus. So, if you're taking drugs, your baby is also taking drugs. And that's unfortunate. And babies can be born addicted to drugs, and then they have to go through withdrawal, and they might get treated with some, substances to kind of help them get through that. But yeah, if you're doing drugs, you need to quit doing drugs. Number 1. And definitely if you find out you're pregnant, you need to quit doing drugs. Because you're basically, you're giving your baby drugs too. Medical drugs. It was once thought that the placenta protected the fetus against drugs the mother took during pregnancy. And of course, now we know that that's not true. Whatever you're taking goes through those blood vessels and goes to your baby. So, you need to tell your obstetrician everything you're taking so they know, because some things can be harmful to the baby and some things are okay to, get to the baby. So, like, I had to change my allergy medicine. I couldn't use the allergy medicine I was taking because it would have been too harmful to the baby. I had to use a much milder one. So, it basically was like I wasn't even taking one at all. It didn't help. So, just let them know what you're taking, because, some of those are not good for the baby. Fetal alcohol syndrome, and we touched on that a little bit earlier. A combination of mental, motor, and developmental abnormalities affecting the offspring of some women who drink heavily during pregnancy. 1 in 750 infants suffer from fetal alcohol syndrome, a combination of slow prenatal and postnatal growth, facial and bodily malformations, and disorder of the central nervous system. So yes, you should not be drinking alcohol while you're pregnant. You shouldn't. A mother who drinks during pregnancy risks having a child born with fetal alcohol syndrome. And they have a picture of a poor 4-year-old kid here. I'm not going to show that. Who has, the flattened philtrum. He's got an eye that's going this way, and he clearly suffers from, some problems. Nicotine, tobacco use during pregnancy is estimated to cause 115,000 miscarriages every year in the United States, and the deaths of some 5,600 babies. So if you're smoking while you're pregnant, number one, you're endangering your child's life. But you need to stop smoking, because nicotine can kill your baby. Caffeine. Can the caffeine a pregnant woman swallows in coffee, tea, cola, or chocolate cause trouble for her fetus? For the most part, the answer is no. But it does seem clear that caffeine is not a teratogen for human babies. A controlled study of 1,205 new mothers and their babies showed no effect of reported caffeine use on low birth weight, premature births, or retarded fetal growth. My goodness. On the other hand, 4 or more cups of coffee a day during pregnancy may dramatically increase the risk of sudden death in infancy. And, we're not sure why that is. But if you drink a lot of caffeine, your child is more likely to have sudden infant death syndrome, where they stop breathing. And some people are theorizing that has to do with the lungs, that caffeine increases the blood flow, in the child as well, and that their lungs don't develop as well. I haven't heard any more on that study, but that's the last thing I heard about that. Marijuana, opiates, and cocaine. Although findings about marijuana use by pregnant women are mixed, some evidence suggests that heavy use can lead to birth defects, because THC is a drug. Any drug is going to cause some kind of problem, because it does pass in through the uterus to the baby. So if you're doing drugs such as marijuana, opiates, and cocaine, time to stop so you don't hurt your baby. They go into a little bit more about fetal welfare versus mother's rights. And I'm not even going to get into that. I'm not going to get into that, because this is not a court or a political discussion here. We're talking about human development psychology. But, again, if you get pregnant, don't ingest harmful substances. You know what they are, and they're going to hurt your baby. You have the right to not have intrusive medical procedures while you're pregnant. That's your choice, but you need to tell your family up front. Like, I was very sick. The nurse told my husband when I was 7 months pregnant, she's going to die. If you don't get rid of this baby, she's going to die. They're both going to die, because she's malnourished. She can't even stand up. He had to carry me into the doctor's office. I could not walk. I was that weak and lost that much weight. Looked like a skeleton with a basketball on my belly. And she told him he needed to get guardianship of me, had me declared incompetent so that he could get the abortion. And of course, thankfully he didn't do it, because I told my, family, I want to give him a chance. If I die, I want you to keep my body alive until he's born. And of course, my mother balked at that. No. But I said, yes, those are my wishes. I've put it down in writing. That's what I want. So you have the right to do that. if you're pregnant. Sexually transmitted diseases. Acquired immune deficiency syndrome, AIDS, is a disease caused by the human immunodeficiency virus HIV. It's a viral disease that undermines effective functioning of the immune system. So I think we all know by now you should be practicing safe sex. And if a mother has AIDS, the chances are that the baby is also going to have AIDS because of the blood trading going on in the uterus. So, you need to find out if you have any suspicions that you have a sexually transmitted disease before you give birth. You need to find these things out. Other maternal illnesses, like we know that rubella, measles, mumps, and toxoplasmosis can have, give birth defects to babies. So, if you should get tested for anything that you think, might affect your baby. Maternal age. We are generally having children later in life. And it talks about, the turn of the century when there were a lot of women having children when they were 15 years old. And 20 was considered an old maid. But, fortunately, that's not going on anymore, because it can be a problem because a female is not fully developed. Just because you become sexually mature, as in you start having periods or, ejaculate, your body's not done growing. You're not done growing. So, getting pregnant at a young age can harm the child because it has less room to grow in there. You're not fully mature. And that can have problems. It can have birth defects, a lot of problems. And it's also going to have problems for you because once you start having sex, your body decides it's mature, and then it starts filling you out. So you're not going to grow taller, that's going to stunt your growth. It's a fact. And nowadays, people are having children later. Now, in psychology class, another one, we learned that they said around age 30 is the perfect age to become a parent. That you usually have yourself figured out, usually have a foundation built for your life. Then you're mature enough to bring other people into the mix. Before that, you're struggling. Me and we kind of did things backwards. But, we didn't know until we took our first child psychology class, and I was already pregnant with then. So, but around the age of 30 to 35 is the ideal window to be having children, because you're mature enough to, have the patience to care for the child. You have enough knowledge and confidence to care for the child. And then at age 35 and older, the incidence of birth defects and Down syndrome increases exponentially each year. So the ideal window for having children is between 30 and 35. So also I told my kids, get married when you're 30, start having kids when you're between like 31, 35, and stop when you're 35. And, that's a good way to go. Outside environmental hazards, chemicals, radiation, extremes of heat and humidity, and other hazards of modern life can affect prenatal development. Women who work with chemicals used in manufacturing semiconductor chips have about twice the rate of miscarriage as other female workers tend to have, and they have more preterm births. Infants exposed prenatally to high levels of lead score lower on tests of cognitive abilities than those exposed to low or moderate levels. And they will test the baby for lead. They tested mine. They come out to my home. They want to see, where's your lead paint. And there was some on the outside of the house. All the paint in the house was new, so we knew that shouldn't have been a problem. But, because of that, and like I said, that the siding on the house was put on in the 1960s. So, of course, that wasn't us. And it was you know, a long time ago, but, you know, we have repainted everything since. But, you know, I tried to not have lead poisoning, but there was, you know, evidently a little higher than what they like to see in the blood content, so they wanted to know why that was. But his father was also a mechanic, so that could have been that, you know, he was getting that contact from him. We're not sure. Let's see. Children exposed prenatally to heavy metals have higher rates of childhood illness and lower measured intelligence than children not exposed to these metals. So again, you know, if you're working with heavy metals, and that's a thing, and you find out you're pregnant, you know, it's time to change jobs, you know, because you don't want to harm your child. So you should want to make sure that you don't. And that's where we're going to stop for today. And I hope that's helped you figure out maybe a little bit more why you do what you do. Until next time.